Week 11 of Aon's Public Affairs podcast was recorded June 17th, 2020.
Hello, welcome. Week 11 Public Affairs podcast. My name's Daniel Serota, and I'm from the Public Affairs Group in Chicago. I am excited to be joined by someone who I've talked to a good amount during this pandemic, our President of Health Solutions, Dave Guilmette. Dave, welcome to the podcast.
Hey, Daniel, great to be here. And you're right, we spent an inordinate amount of time together, but all good.
All good. And you had an interesting experience in the beginning of this pandemic, and I have learned a lot about you, and I'm very thankful to have you be a part of Aon as a newly president of our firm.
Well, again, it's great to be here. It's an awesome firm, and especially through this pandemic, our ability to pull together our expertise across our solution lines to help our clients with unprecedented challenges has been a big reason why I thought this would be a great place to be, and I was proven right.
And Dave, one of the big themes that, we've gone through this pandemic, it's been a couple of months. The states are starting to reopen more and more. I just saw Mayor Lightfoot next week is going to open the lakefronts, open some of the bars. Most of our clients are large, mid-size, small businesses all across. How are we helping employers really look at this return to work concept?
Well, I'd have you think about it in a few levels, right? So to begin with, we've done a lot to prepare on the things for them to be considering when they're looking to return workers to work sites. So I know the term return to work has been used, but as I think we've come to realize within Aon, and I'm sure our clients are doing the same, many people are working from home. So we start by saying it's not as much returning to work as it's returning to a work site, to a physical location, or returning to travel, because in many situations, work for the individuals means not going to their physical location, but to a customer's physical location. And there are elements of it that also involve convening, whether it's small groups or large groups. So we've really kind of dimensionalized this along those three dimensions. And we started with a white paper that we released several weeks ago now, Daniel. I've lost track of time with this pandemic, but we shared our expertise and our best practices relative to recovering from a significant business interruption. So we have deep expertise in risk, in people, in health to help clients understand what you need to do in a so-called black swan event. Adding to that, the dimension that we're talking about, a black swan event that involves health. In most situations, the recovery is not about health. It's about a physical plant being down because of an earthquake or a fire or some other sort of natural disaster or otherwise. And in this case, it's that plus the complexities of this being about health for everybody involved in the communities, as well as your employees and your leaders. And so we've really done the best that we can, knowing what we know, to infuse the business recovery considerations with health considerations. So there's a white paper. We have a business recovery framework and toolkit, which is a very detailed outline of all of the things that a business should consider, from the assessment of the physical work site to the risk elements associated with that, to testing, to what your benefits and human resources programs should look like, communications internally and externally. So it's a very comprehensive framework. But I'd have you think about that as essentially helping our clients understand what needs to be done. And I would also compare that to a number of external resources that I'm sure our clients can tap into, guidelines that are being provided by health agencies, guidelines that are being provided by cities where they have their workforces, et cetera. But again, I would characterize those guidelines as being more about what they should consider. The real challenge becomes how to do it. And there's a lot of variation that can go into the how. And as we considered how we can help our clients with the how, we really thought you got to look at this not only in an aggregate level. So I'm a large multinational employer. I've got 10,000 people in 5 countries. I need to set some guidelines and really start to lay out the framework for what we're going to do as we look to recover and bring our workers back to work sites. But then as you dig into it, the variability is not just about the virus itself, but it's about how the virus is impacting different parts of the world, different cities in the United States, and how the officials, the government officials, are responding to that. So if, in my example, you've got an employer with 5 work sites in 5 countries, 5 specific cities, let's just say, it's highly likely that they're going to need to tailor how they bring their employees back to the work site 5 different ways. Because the timing of the virus will be different. If they have a population in the Asia Pacific region, for example, or the EMEA region, or in the United States, and even in the US, they could be in a city where they're on the backside of flattening the curve. They could be in another location where the virus is still on the rise, right? And then you've got different positions that the local officials are taking with respect to releasing the stay-at-home requirements. And so you really need to take all of that into consideration. And as well, you need to take into consideration I'll call it the ecosystem, but think about all of the external players that you need to depend upon to bring your workers back to their work site in that locality in an effective and a safe way. And so as we really kind of digested all of that, came to the realization pretty quickly, this is about, a month ago, 5 weeks ago, that the right way to help clients with the how was to look at this in a highly localized way, to help employers understand what other employers in a similar situation are doing, and to make sure we give them the ability to convene and to align with external stakeholders who are going to be pretty key in helping them to affect their plan, which is what gave rise to the coalition approach that we launched back at the end of May in Chicago that we're calling Return to Work, Travel, and Convene.
So, Dave, work, travel, and convene, key things that you really hit on there. It really hits on the key 3 things which is important for employers to look at. What has Aon done to really form this group? And what other, locations? You talked about regional approaches. I'll note, I believe it was week 3 of this podcast series, I connected with Andrew Minute, who was the CEO of our Singapore office, and really talked about, there's cultural differences too when you think about the different regions of how people do work. And, social distancing in Singapore is a lot harder than here because there's very much that family connection, family culture, but also, everybody eats together. Everybody does very similar things moving forward. And where else, are we looking to expand this coalition as well as we move forward?
Well, let me begin with Chicago, and I'll start with why Chicago. So Chicago is Aon's North American headquarters, as you know. So we have a very significant presence in the city, and felt that it was as much our civic leadership responsibility to help the city recover and to help other large employers like us sort out the best way to bring employees back to work sites in the city and in the surrounding area. So what we did was we reached out to our large client relationships, and this is about 25 or so companies that are names that pretty much anyone would recognize, really well-established kind of who's who business leaders, worldwide business leaders. And we connected with them and we asked them where they were at with respect to their recovery plans and returning their workers to work sites. And as you might imagine, like Aon was, pretty far along, right? And weren't sitting back saying, gosh, we don't know what to do, but pretty deep in their own internal planning. But even the most sophisticated clients were saying there are still some gaps, there are still some things that we're just not sure of because we've never had to do this before. So we think it would be really helpful to have a forum where we can share best practices, we can understand what other large employers are doing who are similarly situated, connect with external stakeholders so we ensure we have the right kind of alignment and we're coordinated in our efforts. And as well, by doing so, we can start to establish a so-called standard approach, standards of care, best practices that serve as sort of a baseline that all employers can adopt. So if you think about, if let's say your spouse works for another large employer in Chicago, and together you're on the MTA coming into downtown, and you work for employer A, and employer A says we're doing 1, 2, 3, and she works for employer B, and they say we're doing X, Y, Z. You look at each other and say, well, why are we doing fundamentally different things, right? Aren't we both going back to office settings in the loop? And the answer is yes. And so how do we ensure that we can establish a set of standards that one would give employees peace of mind that what they're doing with their employer is similar to what others are doing. Two, it establishes the best practices. So it's sort of a floor. Other companies may want to do more than that, but at a minimum, everyone wants to do this because we've concluded that it's the best thing to do at this point in time. And we also think that that's going to have a positive influence on how insurers look at the business risk associated with returning workers back to work sites, because that's a big concern that all businesses have, the overall liability, et cetera. And so we formed the coalition to really enable these large employers to share those best practices. And then we've also created a business readiness assessment, a diagnostic tool. It's got, over 150 questions. It covers 9 or 10 different categories, really everything that's end to end that an employer needs to consider. And part of being in the coalition, we're going to assess using that assessment tool all of those companies. So we'll have the benchmarking data that will be so important to point out where we're likely to see congruence in ideas and approaches, and probably some gaps that we'll want to work on. Some of the gaps I suspect will be in areas like testing protocols, where, again, that's a big unknown. Employers haven't had to do this before. So should we do temperature checks or not? Are we going to provide PCR testing support, facilitate that or not? What about on the contact tracing side of the equation? You're going to use technology. Everybody needs to contact trace. The city's going to want to do the same thing. How are we going to do this? So there'll be those kinds of questions that we suspect will be surfaced from the assessment survey, and that'll give us a really good starting point to dig in. The other thing I would mention before I get to the scaling is, and I learned this early on as I was really digging into this, I was thinking we're in a sprint. We need to be ready. We need to have answers to all these questions by, fill in the blank, by the day that the city says we are now going to release people from stay at home and you can come back to work sites and restaurants and whatnot. So June 1, June 15, July 1, take your pick. I was wrong. This is not a sprint. This is going to happen gradually. And in some cases, gradual could be between now and the end of the year. In some cases, it may mean spilling into 2021. Because again, this is an uneven event. You have some cities that are in different stages. You have some places where there's been a recurrence. Singapore is an example of that. Hong Kong is an example of that. Unfortunately, we may see cities in the US where we'll see examples of that as well. And so you need to be able to be quite agile in terms of thinking about when you bring people back, when you tell them not to come back, and really ease into this gradually. So percentages of workforces are likely to be targeted first, not everybody. And that'll happen over many weeks and months. And so we have to be adaptive. We have to understand that we have to learn as we go, and we have to keep the information that we're gathering around us front and center so we can continue to adapt the approaches and make sure that we don't lose sight of the goal, which is we want to do this in as safe and effective a way as we can. Now, to your question about scaling, we're starting in Chicago for the reasons I mentioned. We're going to learn from it. So we're piloting this coalition approach. We have many requests that are in from our colleagues around the US and around the world to launch similar efforts. And so we've identified a number of cities that are likely candidates to do this. New York City is one of those. We've talked about Atlanta. We've talked about Dallas. We've talked about Detroit, Toronto, Singapore, London, Dublin, potentially Tokyo. We recognize that we need to be able to do this to support our clients who have large geographic footprints in as many places as we can. There'll be limits in terms of our capacity to be able to do that at a global scale and to do that quickly. But it is our intent to scale up this model. And if not an actual coalition, then certainly to use the benchmarking assessment diagnostic tool so that we can get local benchmarks established, which will be super helpful for those clients to understand what other clients in their market are doing and what the best practices would look like.
Yeah, and I'll add, Dave, I think from the diagnostic tool, I read through some of the questions that we're going to be sending to clients. I thought what was really interesting is it really shows Aon's capabilities overall. It goes into a lot of different factors of retirement, investment, law and ethics, compliance, all of the different things that we touch on with clients. And it really brings out, which is not surprising, we're getting a lot of requests from our colleagues, but also clients that they want the full holistic approach and then take a benchmark that we're going to be able to use to be able to compare best practices based on what others are doing. And I think it's really exciting. And I think it's also going to be, from the public affairs perspective, in my world, public officials are going to want to utilize what we're seeing and what we're hearing from folks more broadly and across the globe. Because I do think when you hear it from others on how they're approaching it, it helps you take what they're doing and really relate it back home to our different areas. And public officials will be able to utilize this for the long term. And I couldn't agree more. It's definitely a marathon, not a sprint here. I definitely think we got to get it right, but we got to make sure we're all aligned as employers moving forward.
Well, let's hope it's not a marathon, but it's at least a 10K. Let's put it that way. We know we need to have endurance. We know we need to set some milestones along the way, and we're going to be at it for a while, right? So that's how I think our team is orienting around how we do this. And I think it's also important just to acknowledge that while Aon's got tremendous expertise in so many different areas, as you pointed out, you could look at this and say, well, this is a benefits issue, and you'd be right. And it's a time off issue, paid time off, unpaid time off, right? Yes. And it's an HR policy issue, and it's a safety issue, and it's a health issue, right? And it's a community response issue. It's a lot of different things. And so while we have expertise in each of those areas, I think it's also important that we approach this, we Aon and we collectively with our clients, with some humility in knowing that we do not know every answer to every question because we've not had to deal with something like this before. So that's why it's going to be so important to stay agile, to continue to pull in the information that we're able to gather, to have the data using the benchmarking tool so it continues to enforce and inform us on what are the best practices, or at least what are the common practices, because there's strength in numbers, right? If we're all doing it this way, at least we can look around the table or look in our communities and say, this is the standard that's been established, and we understand what it looks like. And we can evolve it, as more information comes forward and as we learn more about the virus, as we learn more about how companies have responded and what the experiences have been like. So it's a highly fluid thing. It's somebody put it to me, it's a wicked problem, and not in a good way, but we think we can bring our expertise to bear and hopefully add a lot of value and help our clients along the way.
Yeah, and I am excited to see how this evolves too, especially where we scale and look at other cities, other regions, and see what the results are from the benchmarking. And Dave, I wanted to end with one last question, something that you and I have talked about on many occasions, but I think it's important from the perspective of health. And how do we think overall, or how do you think, I should say, delivery is going to look like in healthcare? The uproar in telehealth, there's other ways that we're seeing care during this time be delivered. And do we think that this is going to change permanently? Or do you think that eventually, once we get a vaccine, eventually, once things get moving, we're going to go back to normal moving forward?
Well, it's a big question you're asking, and I'd give you a few headlines. One, the health system in the U.S. and the health systems across many countries have been stressed beyond anyone's imagination. And I think it's really calling into question the resilience of our health systems, or the lack of resilience. Big reason why government has taken the steps that they have taken across countries to sort of flatten the curve is to not crush the health systems if you didn't flatten the curve, right? So we made some really important trade-offs and incurred some very significant economic costs associated with trying to maintain some level of stability in the health system. So what does that tell you? It tells you that we don't have a system that's as resilient as it needs to be, and that has to be addressed. And at the same time, you had demands from individuals, patients, and people in general that couldn't be met, right? So access to primary care, access to specialty care of different sorts was curtailed in a very meaningful way. And it's not that the demand or the need went away, it couldn't be addressed. And so other alternatives kind of were sought, including telemedicine and virtual care. And we saw the utilization of those modalities jump multifold. The statistics I've seen from some of our supplier partners are just mind-blowing. I mean, you're talking about single-digit adoption of telehealth, which most large employers offer as part of their benefit plan in the US, going from 3-4% utilization to 30% utilization in the course of a couple of weeks. So we don't think that's going to go back to the way it was, nor do we think it should. There are really interesting ways to deliver healthcare more effectively, more efficiently, more conveniently, that could also support the overall goal to strengthen the resilience of the healthcare delivery systems. And we got to pursue those. So I think that's what will be happening in front of us. It's going to be a gradual thing. It won't be an immediate thing. But when we talk about returning to normal, it's returning to normal and returning to better. And this can make it better. I also would point out that the needs of folks to be served are also going to be different. So I think we need to recognize that, and I think we do. I mean, I feel it personally, you probably do as well, that this pandemic has had an impact on our mental health. And sometimes you feel a little stressed, and sometimes you might feel very anxious. And people who already have mental health needs are likely to see those challenges exacerbated as a result of this. So when we think about the resilience of the workforce, we really have to think about, well, how are we as businesses going to support our workers with those needs as they carry those back into the workforce? And so there will be a demand for new and different kinds of behavioral health programs. We're going to have to figure out how to address that and use the virtual health and the telehealth modalities as ways to be able to increase access for care, because people are going to need that kind of help. This isn't going away overnight. And while humans are very resilient as a species to forget about things that are painful, this is going to be around for a while. We're going to need to make sure we're helping people manage the mental health impact of everything that we've gone through over the last several months.
Well, Dave, I couldn't have said it better. And I agree with you. Two biggest driving businesses, therapists and divorce lawyers, I think are going to be two of the upcoming. And well-being and your health is so important during this time to continue to stay active, sane. And I know that not sitting in these four walls, it's important to get outside as much as possible as well. So that is definitely for sure. So Dave, I want to say thank you for joining the podcast. Really appreciate your leadership. And I hope I can get you back in a couple of months to really talk through a little bit further of kind of what benchmarking have we seen as well from this coalition, as well as any other updates you can provide to our viewers.
Happy to join you again. You've been a great host. I feel like I have been on Dan Rather's big interviews, so I feel like a special guest, and thank you for making me so welcome.
Well, you're always welcome. So thanks, Dave, for joining the podcast. If you want more information and to get a little bit more details about the white paper, as well as the assessment tool, visit aon.com/coronavirus. And next week, we're going to be joined by Congressman Raja Krishnamurthy, Congressman from Illinois, who has really been working on a couple of key things during this time of COVID, and pre-COVID really worked on workforce training. So we'll talk a little bit further about the work he's done and kind of what he sees in workforce. Please stay tuned next week, and we look forward to seeing you. Talk soon. Bye-bye.
This information is a resource for Aon clients and business partners. It is intended to provide general guidance of potential exposures and is not intended to provide legal, regulatory, or medical advice. Due to the dynamic nature of infectious diseases, Aon cannot be held liable for the guidance provided. We encourage listeners to seek additional information from credible sources. Thank you.